Malaria remains a leading health challenge in the Bukedi sub-region, where prevalence is very high compared to other parts of Uganda. The Indoor Residual Spraying program is part of government efforts to eradicate or prevent malaria, alongside the distribution of free mosquito nets. However, the indoor residual spraying, which according to health officials is a very effective strategy to control malaria transmission, is facing opposition from the locals in Bukedi region. Community members, especially in Kibuku and Budaka districts, claim that the chemicals used to spray can cause impotence in men. They also claim that they have not seen reduction in malaria cases months after the spraying began.
That program really, it has been quite after some time, but people have failed to realize exactly whether what they are spraying is real.
And there are people, even when they go to test, you realize you're positive. They give you medication. After some 2 days, again you go to test, you're positive. So we are not seeing the impact.
The IRS program targeting the female Anopheles mosquitoes aims at reducing the high malaria burden in the region and the country at large. The exercise is covering Budaka, Kibuku, Butevo, among other districts in the Bukedi sub-region. Moses Musana, the LC3 chairperson for Kameruka sub-county in Budaka district, said that his area registered high cases of malaria, which made people doubt the effectiveness of IRS.
Malaria is very rampant, and even I'm wondering why is it so? Because according to the program of IRS, it is now more than 3 years or 4 years when they are spraying around. The problem is still existing. I don't know what is bringing all this. When you go to the health center 3, records in 2012, 2015, the malaria was not too much like it is nowadays. So I'm wondering why is it going ahead every year.
He also claimed that health officials have not adequately sensitized the people on the impact of spraying.
I tried to tell the district leaders what is on the ground, and I advised the leaders that no, let us sensitize up to the parish level. But the moment they come to the sub-count, they reach there and they go back at the district.
Arthur Wakomboizi, the Budaka County Member of Parliament, said that as leaders, they support the spreading and it must continue. He pledged to work with the police to arrest those decampaigning the program, especially local leaders, who he says have misled the people.
People are dying in numbers. And when people die, they blame it on superstitions. This who brought the medicine, it is making our children urinate blood, it's making us children lose blood. But when you get malaria parasites, they attack the liver. And once the liver is attacked, it also goes on self-defense. It stops producing blood and white blood cells. What happens next? The kidney cannot do the work of filtering. The capillaries break in the kidneys. That's why you keep urinating blood. I'm not saying this as a pedic, but it's common knowledge. But the problem with our people here is that, one, they are very stupid. Two, they are so dirty. Hygiene is very poor. Because our people are too dirty, people don't want to bathe, people urinate on their beds, the house is so stuffy, the mosquito knows where to go. Smelly armpits, the mosquito just goes straight because when it reaches your house, it has already known the target. It will not go on the wall. So you end up saying we are suffering from malaria and the insecticides are not working. That's not the case.
Dr. Rogers Natulinda, the national coordinator of the Indoor Residual Spraying program in the Ministry of Health, said that the IRS program in the Bukedi sub-region is aimed at eradicating malaria and having people healthy.
Because currently we are actually having epidemics in these districts. Okay, so we are targeting 8 districts for this spraying. Last year, November, December, we sprayed about 13 of them in the other region. Now here we are spraying 8. I don't have figures of the exact population. I'll look at that, but it's approximately 3 million in the 8 districts. So the thinking is This epidemic, which actually has caused dire effects, has actually caused serious complications. We have children who are urinating blood, passing blood in urine.
Uganda has one of the highest global burden of malaria cases, with over 90% of the population at risk. Malaria is one of the leading causes of death, especially in children. The disease is responsible for 30 to 50% of outpatient visits and 15 to 20% of hospital admissions. In 2021, the World Health Organization reported an estimation of 13 million malaria cases and over 19,600 deaths in Uganda.